Okay, I believe we're now live on YouTube. I'll just confirm that.
There's we're live, so I think I'm just going to start, if that's okay with everyone. Okay, welcome everyone. Welcome to the public session of the Oversight and Engagement Board for the 20th of August at 10:15 or thereabouts. Good morning, everyone. Thank you for joining us, and we're live on YouTube. I'm going to deal with item 10, the minutes from the previous meeting held on the 13th of August in the public session. If everyone's okay with this, I will assume that those minutes are acceptable and that we will sign them off. Just looking. Lucy, yes, did you want some amendments? Hi, Lucy.
Hello, just to mention that it is referred to as the test and trace service for the items currently noted as track and trace.
Thank you, Lucy. We'll sign them off subject to that amendment, and going forward we will rename them as you say. So we come to item 11, which is the summary of local surveillance data, and it's back to you, Lucy Whiteman, the Director of Public Health.
Thank you and good morning everybody. So this is the report that is published on the Northamptonshire County Council website each week, which provides the postcode level data for the COVID-19 cases in Northamptonshire. So we've been producing this for a number of weeks and obviously refining it as we go. So at the moment it still has the warning on the front, very much still front and centre, that we have got an increasing number of cases in Northampton, Corby, Kettering and Wellingborough, and that we are obviously requesting that residents in those areas and more broadly across Northamptonshire, it's best practice to remain vigilant and to undertake restrictive activity in relation to mixing outside of their social bubble or their family, to maintaining social distancing, because that's still key to reducing the onward spread of coronavirus. If you must meet people outside of your household or your bubble, to try and meet in an outdoor space. If that is not possible, to meet indoors but using a face covering. If you have to use public transport, avoid where possible, but if required to again wear your face covering, not only while you're queuing to actually get on public transport, but throughout the journey. Obviously, again, if you're able to avoid car sharing, to do so, but where you do need to do it, please to obviously do so with a face covering in use throughout the journey. To continue with that regular hand washing, it's still one of the most basic and most effective ways of reducing onward transmission of a number of viruses and infections, obviously coronavirus included in that, and obviously where it's possible to still work from home. We recognise that these are challenging times and that these continue to be difficult messages, particularly as we do have a sunny day today rather than the rain we've had for the last few days. People will be tempted to go out and about and to socialise, and we implore people really to remember that we still have a significant number of cases. In fact, as a county, we are now statistically significantly higher than the England average. And that obviously we continue to be challenged with things like local outbreaks. We still have a recommendation in place that multi-team sporting events do not go ahead, and we're also working extremely hard with our environmental health officers and the police to ensure that any event, non-sporting, that is planned over the next few weeks has a full risk assessment, and where we are not confident that the risk of COVID can be managed, that we would be taking steps to actually restrict or prohibit events going ahead. Such is the increase in cases locally, and obviously the concern both at a local and a regional and national level. If we go to the data specifically, on slide 6, you'll see that we've, in the week up to the 9th of August, had 3,743 positive cases of COVID-19 in the county. Of that number, 151 had been identified in the week up to the 9th. Now, just for the public's clarity, the Green Court outbreak doesn't feature heavily in this publication due to the cut-off from a point of view of the data that informs this. You will see a significant impact in numbers in tomorrow's report. But as I said, this data obviously covers the week up to the 9th, whereby all of the Green Core tests have not actually been processed, but you can still already start to see in our county that really quite steep increase in the number of cases locally. On slide 7, you can see a breakdown, as we talked before, about the fact that COVID is now impacting on a different population to that it was at the beginning of the pandemic, much more so the working age. And you can see also there's been an increase in the 0 to 19s cases quite significantly in the last week or two. So again, making sure that people recognise that this is something that is broadly out in our communities, and that we all need to be trying to adhere to those tighter restrictions to stop the onward spread. Slide 8 gives you a breakdown, so you can see there, as I said, the red arrow around Northamptonshire, which indicates that we've had that significant change in pace of COVID infection locally, and that it has gone up considerably. Those cases increase in focus in Northampton and Wellingborough, and then Kettering, so our high urban areas. But you can also see that we still have cases appearing in East Northamptonshire, etc. So it isn't unique to our urban areas. Our rural areas are still affected, albeit at a slightly lower rate. So slide 9 summarises the fact that, as I said, Northamptonshire is now statistically significantly higher in its rate per 100,000 population compared to England. And again, we can still see that the focus of cases is in Kettering and Northampton. Because of that, as I said, we are making sure that people continue to understand the messages and socially isolate if they are indeed worried that they have got COVID-19, that they seek testing immediately, and should they be identified as a positive case or a household contact, to self-isolate. Now, the steep increase is illustrated really well in slide 10, where you can see the cumulative number of cases over the period of the pandemic by borough and district. As I've said before, slide 11, I think because it's that rate, so it makes it comparable to each area, you can see that steep increase in both Northampton and in Wellingborough. East Northampton's dropping off a little, but again, Corby, you can see quite a sharp increase, although it does remain below the Northamptonshire average. So really some trends there of concern across different boroughs and districts. If I jump, if I can, to slide 15, which gives us that summary of the last 28 days worth of cases as a rate per 100,000. So again, makes those areas comparative. We can see there's real focus in Clifton and Rushmere. Moulton, which is obviously the site of Green Core, so this you can start to see the cases that went through that initial pillar 2 testing, so the local testing sites before the private testing was undertaken. You can see the increase there in some of those cases. Blackthorn and Lings, and then in Wellingborough you can see Victoria and Isbrook there featuring. So real focus on some of the more deprived areas in our town centres. From a point of view of outbreaks, obviously I've touched on the fact that we have a significant workplace outbreak. At the moment there are 16 outbreaks that we are actively managing. 11 of those in care homes, 3 of them in workplaces, one of which obviously people are aware of as Green Core, and 2 in hospital and hospice settings. Exposures are where you have a single case who may or potentially have been exposed to contacts within a setting. Again, we have the odd case in care homes, and that's because we're doing routine testing of staff and residents there, and those people are obviously isolated as soon as that notification comes through. And again, you do still get single cases in workplaces, which, as people can see from the data we monitor. And then clusters are just 2 or more cases that actually aren't associated by time or place, but obviously we keep an eye on those to make sure that they don't spread, and again that we understand what the root cause of those may have been. So all in all, there are 448 cases that have been affected by outbreaks, exposures and clusters that we are actively currently managing. So our ongoing actions continue to be making sure that we push out our messaging in appropriate languages, in appropriate formats to everybody who is currently affected in a high-risk area, but also generally reminding the wider Northamptonshire residents of how they can access testing and what they should do if they feel they've been exposed or are indeed experiencing symptoms. We're looking at that postcode data and it's helping to shape our messaging, and also the ways in which we communicate our messages through community leaders, etc. And our environmental work health officers and Public Health England colleagues are continuing to support us magnificently in relation to particularly the management of outbreaks, and also we've got a number of community wardens and licensing officers, etc. at borough and district level who continue to help us monitor and maintain levels of compliance, particularly around our nighttime economy, where we still see some locations where we would want to see tighter arrangements around the contact tracing details, so that should cases arise in particular settings, we're able to identify and contact people who may have been at risk. But our big message here is, again, still reaching out and asking that the residents of Northampton continue to be vigilant, adhere to those slight restrictions. We would hope that we don't have to take further steps, but obviously, particularly with a significant increase in our cases and a large outbreak locally, we do need to recognise that this is a challenging time for the county. So please, we ask people to play their part, make sure that they are adhering to all of the requirements and seeking testing whenever they have any concerns. I stop there, and Councillor, back to you.
Thank you, Lucy. That's a very good summary, as always. And it is worth pointing out that all our meetings are streamed on YouTube, so all the data that we get is shared widely. There is certainly no hiding of data or no hiding of figures or facts. That all the information that we get at these meetings is shared widely. So any criticism of us or indeed of Lucy Whiteman as DPH for not sharing information is erroneous. The information is very widely shared and easy to find as well. So I would just like to point that out. We'll come on to the next bit, which is the situation update, and that's back to you, Lucy. Thank you, Lucy.
So I think obviously at the moment we've summarised the situation for most areas. I'm sure people are keen to obviously hear about the Green Corps outbreak itself. One of the most important elements of this is making sure that obviously people understand Green Corps itself has been hugely supportive of the current situation and continues to work with us very closely. And it isn't unique in its setting. As you've seen, there are a number of risk areas from a point of view of outbreaks, and we continue to work with all of our high-risk settings so that we can try and proactively manage that risk, but also make sure that we've got relationships built, so should an issue occur, we've got routes in to help identify and stamp that out as quickly as possible. So people will know that Green Corps is a large employer locally, 2,100 employees, some of whom have been furloughed recently, as with many organisations, many of whom have been working from home. Clearly, people in the production areas of Green Corps are able to work from home, and therefore we tested all of those that have been present over the period that was considered to be infectious, and that was around nearly 1,300 employees that were tested. Just over 1,100 through a private company, and then around 152 had gone through some kind of NHS testing portal between the 27th of July and the 9th of August. And obviously it's some of those results that brought our attention to the challenge in Green Corps itself. We have had a number of duplicate reports which we've now managed to eliminate, so we know that the total number of positives up until the 13th of August was actually 287, and we are going through a process as we speak of testing all of those that came back negative, and also working through a process to deliver tests and ensure that people who are furloughed but who may have had contact with those positive cases or that have any concerns are able to access testing as well. We've got a wide age range of people affected, median age being 45. So as we saw in that population triangle earlier, this is working age adults that are affected. We've got a range of nationalities and languages spoken in Greencore and across indeed the whole of our county. So we're making sure that we've got accessible resources so people can get hold of information in a language that's most familiar to them. And as I said, in a format that's most familiar. And I'm sure our comms colleagues will talk a little bit more about the options that we've been providing. We've got focus of those cases from a point of view of their residential addresses around the town centre in Northampton and also the town centre in Wellingborough, where we've got around 15% of cases living as well. There are some households where we've got more than one case, and obviously we're making sure that where that increased risk exists, that we're working with those household members so that they're able to socially isolate as appropriate now that they've had a positive diagnosis. So we're doing all we can to make sure that people have what they need to be able to follow best practice advice, so that we're hoping to see a significant reduction. Obviously the number of cases over the next few days and trying to eliminate the risk of onward transmission. But obviously we recognise while we're going through a second testing regime with those initial group that came back negative, we may well see a number of cases come out of that process as well. But we felt it was best practice to make sure that those people were able to see whether they'd also been exposed to any risk.
Thank you, Lucy. I'm just seeing if there's any questions on that section. It doesn't appear there are. So if we may, we'll move on to item 13, which is a testing venue update, and Sharon Wright. Sharon, are you there? Hi, Sharon.
Yes, I am. Hello. So if I start with our local testing sites, we've still got sites in Corby, Kettering and Northampton, and we see a steady throughput through those with an average daily throughput of around just around 200. Northampton has slightly more towards 300, but we do get a steady throughput through there. Just a reminder, they are open from 8 till 8, 7 days a week. So there's good access into there. We do also supplement the county with the mobile testing units, and they are mainly going into other areas where we haven't got the local testing site. So at the moment they're sitting in Daventry, and then we'll move into East Northants. And we've also got a supplementary mobile testing unit on Moulton Park to pick up people that work in the industrial areas, and we are looking at a testing strategy to move out to other industrial units across the county, because we do know that some of the staff at Greencore do car share and drop off at various state industrial units across the way. So that will help us to understand what is going on in other industrial units. As you remember, we did bid for a regional testing site, which is going to be in Kettering, and I'm pleased to say that the project manager has moved forward on that, and the contracts are just being put together, and we should get a high level project plan on that with a go live date, and I will share that chair with the group to know more around that. If I'd just like to bring notice to the national study, the ONS national study on COVID-19, where, if you remember, the CMO has published recently around that we are going to be sending that out to more people around getting them to be involved in the study. And I think I'd just like to promote that if anybody does get a letter through the post, to really take that forward, because that will give us much more information about the spread of disease across the country.
Thank you, Sharon. Very good report. Thank you very much. So I'm going to come on to item, looking around the room, questions. So no, item number 14, which is the comms and engagement update, which is from Sarah Newell. Hello, Sarah, are you there?
Hello. Yeah, can you hear me?
Yes, we can hear you. Thank you.
Yeah, just checking. Sorry. Okay, so this week the communications team has been extraordinarily busy. There was a huge volume of media requests from more than 30 outlets on Thursday afternoon alone regarding the outbreak at the Greencore factory. These requests were local, national and international. We held our regular press conference on the Friday. It was attended by the local and national media, Sky. Nunn has been very busy. He's been interviewed by ITV, the BBC, Radio 4, Good Morning Britain, to name a few. Yesterday, one of our public health consultants, Rosin Harris, gave interviews to the local BBC about our own contact tracing. She was interviewed by Global Radio, ITV Anglia and the local BBC. Lucy Whiteman, the Director of Public Health, now has a twice-weekly slot on BBC Radio Northampton, which addresses the questions of the day regarding the current situation. The Comcel's been working together with district and borough colleagues to ensure all activity is delivered across county. There's ongoing promotion of all testing sites in the county, which is updated twice daily. The track and trace posters, which I mentioned, were going to the pubs. I've just had an email that they've actually gone to all local councils to be distributed by environmental health officers and town centre managers to be handed to pub landlords to put up. We're liaising directly with shopping centre managers to ensure there's signage at the point of entry, reminding people to wear face masks. We're currently editing a video recorded by Lucy Whiteman, thanking the people of thanking Northamptonshire residents for their support. We've increased social media activity around testing and symptoms of the virus. We're scoping out the use of digital, I've missed a word there, sorry, digital channels to communicate public health messages and information. Regarding actions which are specifically targeting the BAME residents across the county, we're working closely with BBC Northampton, who offer to translate the adverts which we currently have running on the commercial radio stations. So they're going to translate them into the top 4 languages and run them for us, which is a very good partnership working, finally. We've produced a poster which focuses on what to do if you receive a positive test and how to self-isolate. This has been translated in Polish, Latvian, Lithuanian, Punjabi and Hindi. This piece of work was directly related to the outbreak at Green Corps. There's a Lithuanian community in Corby, and we are currently translating a video offering COVID-19 advice. This is also being translated into Somali and Punjabi. We've created a Facebook video which will target specific areas in Northampton and specific communities. We're preparing adverts to run on the community radio station Inspiration FM, who are invited to our weekly press conference. We are finalising a series of 4 animations which we will distribute on social media. We've prepared a comprehensive FAQ document to sit on the website. And we are conducting a website accessibility review, starting with a weekly surveillance report to make sure that they are accessible to all. I think I'm happy to take any questions, but that's a general update.
Thank you very much, Sarah. I do have one question. I've got David Jones from Health Watch. David, hi.
Thank you, Ian. Health Watch is a statutory body that is there to speak for people who use health and social care services. So it's a public voice in this. And I just want to express appreciation for the transparency of information, the very comprehensive reports that are presented from Public Health. And also, having heard that report, the extensive public information campaign and the really committed work that's going on. My question is, and I say that very genuinely, it's very difficult to get this information out, and we are frustrated by some delays sometimes from people who, from the national system, but it's really good to see the local approaches, and thanks, Lucy, for all your work on that. The question that I'd like to put is that given that it is so complex, it's very easy for the different media to have slightly different messages. So Sarah, could you just say to us how you're making sure that there are straightforward, simple, consistent messages that the public can see? I've had 1 or 2 comments that people have looked at different sources and seem to get different information. So it's really important that the key messages are simple and they are consistent everywhere. Could you just say how you're making sure that that happens? And thanks very much for all that hard work.
Okay. Yeah, our key messages were decided upon a number of weeks ago, and they are as simple as we can possibly put them to ensure the widest audience possible can understand them. I'm not. If we could address possibly the exact issue of the misalignment of messaging, maybe I could answer that question, but without knowing what it is,
I think
it's quite difficult. Was it the issue about the website that came up last week, possibly?
Just for clarity for everybody, we have slightly changed the messaging with the recent outbreaks, and people are looking to say, well, what do we have to do that's different? Lucy's been very clear about it, but it's how we make sure that all of the different media are having the same message, and just looking for public clarification of that.
Yeah, well, they come from one source, so they come from the communications cell. They're all signed off. All messaging is signed off by the Director of Public Health, Lucy Whiteman. So if that messaging is not being relayed to the public properly, that's certainly not coming from the source.
Lucy, did you want to come in on that question, Lucy?
If I may, Chair. So our key messages have actually remained the same since Northampton became an area of interest. What we have obviously done is include other areas in the recommendations because we've seen an increase in cases in those areas too. What I think is the challenge is there was a delay in some of the various websites with our borough and district colleagues because everybody is so very busy in updating their information. So we've corrected that by making sure that all of the information is signposted back into NCC's website. So there's one main website that feeds the districts and boroughs that has obviously all of the latest information on it, including our outbreak plan and some of the background documents information. We have escalated as well the challenge that if you go on to, for example, Public Health England's website at a national level, of course, it still talks about the national messages and doesn't reflect what local restrictions may be in place. And we have asked to see if we can have that corrected, or at least for Public Health England to recommend for people who land on their page to seek advice from their main sort of county or borough and district council. So we're trying to correct, I think, particularly this disparity in messages between the national portals and our local requirements. So recognise what you're saying, David, and there are some challenges there around some of the national messaging.
I think that's really helpful. I'm not raising questions to be critical, but just to make sure that we're all held together, and that's been really helpful information. Thank you very much.
Thank you, David, and thank you, Lucy and Sarah, for that comprehensive response. I do think the messaging has been very clear from my perspective, but sometimes when you're more involved with something, it can make it look clearer to you than it does to other people. But I know everyone's working very hard to make sure that the messaging is very specific to the areas as well as to the locality. So I don't see any other questions, in which case, if everyone's happy, I'll move on to any other business, unless anyone's got any other business. There is no any other business, I don't think. So I'm looking around the room. No, perfect. So item 14 is future meeting dates. So we've got a number of these. We've got the 27th of August at 9 a.m. We've got the 4th of September at 9 a.m. The 10th of September at 9 a.m. and the 18th of September at 9 a.m. Thank you very much, everyone, for attending today. And stay safe, stay well. And everyone follow the guidance, and we can get control of this situation in Northamptonshire.